Grand Chief Daniels, thanks so much for being with us. With 5,300 doses going out this week, that'll reach a pretty small portion of the population. Can you tell us who will be receiving the vaccinations?
Well, we advocated very strongly that every single First Nation is reached in the first round of vaccinations, which wasn't the case in the beginning. So we wanted to ensure that we would be able to do that. And so when we looked at the numbers, we're able to vaccinate, I think, everyone who's involved with the healthcare system, so everyone who's all the nurses and health people in our communities. Secondly, we're also going to be vaccinating people who are 70 and over. And then in February, we'll be vaccinating 60 and over in communities. And we've also heard from the province that our First Nation citizens who are living in urban areas, the vaccination, the age requirement for the first round of vaccination will be at an earlier age, given the disproportionate healthcare outcomes for First Nations.
How long until we can expect to see needles in the arms?
Well, I think that they're going to be rolling it out, I think, even today from what I'm hearing, and tomorrow, but for sure Monday is what we've heard in terms of starting to really ramp up.
You know, given the way that the vaccinations need to be stored and lockdowns and everything, can you describe the logistics of getting these vaccines to the communities?
Well, it's a matter of ensuring we have the right people in the community who can, who know how to store and handle the Moderna vaccine initially. I know there's now talk of the Pfizer vaccine being distributed a little more widely, given that there has been some indication that it can be transported in a better, more safer way, so that there's so that the vaccine won't be obstructed in any way, and that'll still be useful, still be very effective.
The province is saying another 5,300 doses will be going out next month. Will that extend who's eligible for the vaccination?
Well, we based our our conversations around trying to expand it so that every community would be involved in this first round of vaccinations. We didn't want any one of our communities being left out of this. And so what that did was that changed the criteria. Initially, we were thinking 60 and over, but because of the very limited amount of vaccines available, we had to make changes to 70 over. Then, and that's only within the first month. The first stage of the vaccine is actually between now and March, and so our goal here is that everybody 60 and over will be vaccinated by the end of March.
First Nations people account for half the active cases in the province of Manitoba right now. What is the impact of getting these doses out?
Well, it's going to give us peace of mind to know that our knowledge keepers, our people who are most vulnerable are going to be protected, and hopefully we can save every single life possible. And that was the intent of our advocacy efforts, and that's why we immediately called for First Nations to be prioritized. And not only in our communities, but we've also pushed to have our First Nations people prioritized in urban centers, where we're saying 60 and over, given the life expectancy is almost 11 years for First Nations, and also the impacts that we were seeing in the hospitals, where we had a disproportionate representation of First Nations being hospitalized and in ICUs.
Well, Grand Chief, good to hear the vaccines getting out there. Appreciate you taking some time for us here today.
Thank you.